saturation, okay? So just set that there. And I'm going to get your temperature as well. And I'll take that. Thank you. Okay. And finally, right eye first. Okay, good. Yeah. Now you can blink as much as you want. Perfect. And let's do this left eye. Okay. Okay, I am going to have to touch you now, so I'm going to get some gloves. The next cranial nerve is actually three of them, sorry. And we will be testing your eye movement, pupil constriction, and eyelid elevation, okay? So, I'm just going to do an inspection here of your eyelid, checking for any drooping the eyelid, okay? Perfect. Okay. And there will be a bright light now. Okay, we're gonna check your pupil constriction. Good, and I'm going to perfect. Okay, and I need you to follow my fingers now, okay? Good. Perfect. Okay. The next is your facial sensations and jaw movement. Okay, so I'm going to touch your forehead, cheeks, and jaw with a cotton swab. taste like? Orange, perfect. And let's do this one. Okay, thank you. What does that one taste like? Come one or two, okay? Okay, here's one. And here's two. Okay. One or two. Okay. One or two. Excellent. And one more. One or two. taking? And what's that for? Okay. And how much time do you spend staring at a screen a day? Just on average, yeah, take a guess. Okay. And what is your work environment like? Okay. Perfect. So, we can go ahead and get started. We will be starting with a physical exam. The first part of the physical exam, I'm just going to be looking. I won't be touching. After, I will be holding your eye open and taking a look with a light as well, okay? Okay. Okay, so let's just take a look at your eyes. Can you look up for me? Thank you. Okay, and look down. Okay. Now I'm going to hold this eye open and shine a light in it, okay? Okay. So hold that and good. And look up for me. Okay. And look down. Perfect. Go ahead, you can blink, yeah. Okay. You ready? And look to your left and to your right. Okay. How'd that feel? Okay, good. Okay, now we're gonna do your left eye, okay? Okay. Hold that open. Okay, look up for me. Good, and down. Perfect. Go ahead and blink. You ready? Okay. And to your left and right. Okay. Perfect. Now I'm gonna go ahead and feel around your eyes as well, okay? Okay. So just feel around. Okay. Perfect. So, that is it for the physical exam. We are now going to be doing a visual acuity test and checking your vision, okay? Okay, so, can you see this here? Okay, perfect. I want you to go ahead and just start reading it down, okay? Yeah. obviously, I will let you know if I do. So, again, this will be another bright light, okay? Okay, so I'm just gonna come in here and good. Perfect. Okay. Ready for the other side? Okay. And very good. Perfect. Okay. Yeah, I won't need to dilate your eyes here. We are now going to be testing your visual fields and essentially your peripheral vision, okay? So I want you to just look at my nose and to tell me when my fingers come into your field of view, okay? Okay, so just keep looking at my nose here. Perfect. Good. Good. Perfect. Yep. Good. Yep. Good. Perfect. Very well done. So, we are now going to map out your corneal topography, which maps the surface of, which maps the curvature of the cornea, okay? So, this is going to set right under your chin. You're gonna go ahead and set your chin on there. Perfect. And then I want you to focus on this, and the machine will come in towards your eye, okay? Yeah, it sounds a little scary, but I promise it's not. It doesn't hurt at all, so just keep focusing on this light. Perfect. And the machine's gonna come in. Good. Just keep staring at that light. 5, 4, 3, 2, 1. Okay. And I want you to keep staring at this light, okay? And the machine's coming in. Perfect. You're doing great. Okay. 5, 4, 3, 2, 1. Beautiful. So, I'm just going to get this tablet here and check out your cornea. Okay. Perfect. So your eyes look amazing. Do you have any questions for me before you leave? Okay, perfect. Well, I hope that this has brought you some sweet solace. Good night. Come in. You are here for a face mapping, correct?
Mm-hmm.
Okay. shut your jaw at all. I really don't want to be bitten today. Oh, yeah, it's coming. Yeah, so I would definitely recommend not having as much coffee as you currently do, okay? That definitely could help with these teeth that are getting a little bit rotten. Luckily, I am having success so far with removing the rotten parts from the teeth. Okay, I'm just gonna go ahead and hold you, okay? Bring you a bit closer here so I can get a really good, yeah, I know it's a weird position to be at. Oh, there we go. Oh man, I lost it. Perfect. Okay. And right here. Oh, this one's coming off easy. Perfect, okay. And I'm gonna have you go ahead and close your jaw. Thank you. Oh, still got some on there. Here we go. Yeah, see how this different position is actually making this a lot easier. Yeah. Okay. You know what? I think this side might be. Okay, maybe I lied. Oh, there we go. Perfect. And one more. Oh, this one's stuck on there. Good. Oh, perfect. Perfect. Got some dirt on there or something. So, your teeth are looking much better already once we remove those rotten parts there. So, let's go ahead and quickly brush them